So one of the reasons I love this facility and this location is because of the abundance of access and parking. This entire parking lot is our own private facility, so you can park and come right in without having to worry about walking a long distance for parking. So this is our private parking lot, and this is how you would come in into the office right here. Hi everybody, welcome to our office. I just wanted to give you all a virtual tour. As many of you who know me know that I'm a very avid technology enthusiast and consider myself somewhat of an amateur innovator. And so I'm taking advantage of these thought processes to contribute and to deliver content and information to all of you. And as such, this is a virtual tour I want to share with you about my office in Plantation. As many of you know, we also have a location in Boca Raton, and we'll do one of those for that facility as well. But when you come in, it's a very open environment. It's very bright and airy and light. We don't like closed off areas. We want to be very transparent, very open, and it's very engaging here. You can see there's plenty of room. We have a lot of content here that you can interact with and learn from. There's a lot of information that's playing that's maybe relevant to you about your procedures, etc. And when you come in, you can also see directly through the office, what's happening in the back with the very welcoming staff that we have that manages the front office area essentially. So many times you'll notice that the front office will actually come out and greet you in the office and walk you back and be very creative and interactive with you. So you come back this way to the office, and one of the first things I want to show you guys is our procedure room for doing various types of treatments. We are a fully comprehensive plastic surgery, cosmetic surgery, med spa practice. As such, I'm the plastic surgeon. I have an esthetician. Actually, we have 4 estheticians. We have a nurse practitioner. We have a nurse. We have 2 facilities. We have a permanent tattoo artist. We do microblading. We have a massage therapist in the practice. And so we are a fully comprehensive practice that offers everything that makes one look good and feel great. And so this is one of our treatment rooms. As you can see, we try to be very simplistic, very clean, very neat. And this is our general hallway. Our office is set up in a very linear fashion where you have consultation areas, you have procedural areas, and you have our own certified operating room that's very clean, that's very specific to what type of procedures we do, and that's very, very private and very convenient. And we are the only ones that are allowed in there, only ones that operate in there. There's no other entities that come and work here because we wanted to make it very private and special. This is where you would meet Jane Alvarado, our patient coordinator or cosmetic coordinator, in the privacy of this room to go over many of the conversations that you'll have to organize your visit. And this is a typical consultation room again. As you could see, it's a very clean, modern, simple, uncluttered room. We do everything with multimedia and engagement, and are very transparent in the way we talk about stuff and explain things. All the rooms are as such in our office that makes you feel very secure, very comfortable, very private, and most importantly, very, very sterile and clean. These are similar consultations rooms. As you could see, they're very similarly organized for, again, sterility, cleanliness, simpleness, modern, interactive, and multimedia focused is what our rooms are about. And this is a common area once the patient comes in for a consultation. If there's any privacy needed, or if the family member doesn't want to be, or the patient doesn't want the family member to be in there, they're welcome to wait out here. And so this is a very common space. One of the things I want to highlight is the importance of art in my life. My sister is an amazing artist. My wife is an amazing artist. All my children are artists. And I am also an amateur sketcher. And it's always been a part of my life since I was a little kid. And so this is a charcoal, kind of a painting or a kind of a sketch that my sister did when she was in college of a grandfather and a grandson. And I put this in my office just as a reminder of how art and science and art and plastic surgery are always together, because you can't teach this in medical school. It's just something that you just have a love for, these intangible skill sets that I think just help you become a better surgeon. So this is another example of artwork that are not purchased, but they're actually created. This is an piece of art that my wife made actually, and we want to be very authentic and real with everything that we do. And so just to reiterate the fact that, you know, aesthetics, art, creativity has always been a part of my life and my whole family, and this is something that my wife put together, and she does dozens of these things, but this is something that I felt was appropriate for the office setting. Okay, so as you walk down the hallway, as you've seen, this is one of our procedure rooms. I'm a plastic surgeon that's fully comprehensive. My areas of expertise are the face. I'm a double-boarded plastic surgeon in ENT and also in plastic and reconstructive surgery. As such, I do a lot of facial and neck-based procedures, including the eyes, the nose, the neck, the jaw, all kinds of different things for skin care, etc. And so we do a lot of small procedures here that include some injections or a lot of injections of, you know, kind of Botox and fillers. We do some skin cancer work here for the face, especially on the nose and very sensitive areas, to help with our work with the dermatology colleagues to get the best cosmetic outcome as possible. So this is where we do a lot of those types of procedures. If you walk down further this way, I will show you our operating room. This is our very private operating preoperative area here. So this is where a patient would come in. We would have them sit down. We would kind of do all of our preoperative workup, including, you know, whatever they need with an IV, and, you know, talk about with anesthesia and all the rest of it. Patient is prepped up in the what we call the preoperative room, and with some instructions if they need on our TV up here. We would then bring them into the operating room here, which is a fully certified functional operating room. We have inspections of this every 6 months. We have an in-person visit also, where, you know, the accreditation boards come in and evaluate everything, the cleanliness, the protocols, the process, the procedures, and whatnot. And as you can see, it's a very well set up room that enables me and my staff to take care of one person at a time. So this is a place where it's private, it's secure, it's well controlled. It's my home. It's basically, this is where I live and breathe and love to work. And so I spend a lot of my time here, and this is where a lot of my operations are done.